Hi everyone, I'm Dr. Lin of Rehab and Revive Physical Therapy here in Tustin, California. Welcome to another episode of Understand Your Pain. Today we're going to talk about a great topic, patellar tendonitis, runner's knee, knee pain in general. So we got some great little anatomical things we're going to get to, but what I want you guys to understand and make sure you have the right information is runner's knee can happen from various sources and there's different points of impact. I always say the knee is a victim of the hip and the ankle, and we're going to talk about that a little bit further later on in this episode, but I want you to understand that a lot of times it's an overactive quadriceps. The quadriceps comes down and attaches to the kneecap or the patella. We'll talk about the little mechanics in a little bit. Alright, we're back. Let's talk about the symptoms of the runner's knee. A lot of the time, it's very mechanical. So every time you push off, every time your foot hits the ground, that's probably the times that get it. If it's happening all the time, then it might be something else. So it's worth going to see your healthcare professional, get it checked out. But usually it's a very mechanical thing. You start running maybe 10 feet, 100 feet, 10 miles, then it starts nagging you, and then once you stop, it should go away relatively quickly within the hour. So if it's lasting longer, it might be something else. So is it something you need surgery for? No, but if you have the correct diagnosis, that's probably the best and most important thing to address your knee. So let's take a look at this anatomical chart company chart that we have in our office and talk about the anatomy here a little bit. What you want to see is this long bone. This is a long chain. The hip is important, and then obviously below we're going to talk about the ankle at another segment, but you can see that kneecap, and the kneecap is encapsulated in the quadriceps tendon, quadriceps muscle, the tendon, if you can see on some of these right here, the tendon, and then the patellar ligament, because it goes from bone to bone. Really important to understand the mechanics here. So sometimes there's inflammation there, and that's the true tendonitis. That's usually like an acute event, and it's new to your body. But if it's something that's a little bit more chronic, we do talk about tendinosis, it being a breakdown, and there's usually a lack of inflammation that goes down, and those things take a little bit longer to help and cure. But if it's a true tendonitis, you take care of it and try to decrease the inflammation first. But I would say if it's a chronic thing, which most of you, I'm guessing, is what you have, you want to be able to stabilize that hip, get the ankle more mobile, and then work out the hamstring muscles to avoid that anterior or that front translation, that translation that goes to the front, that then puts a lot more bowing to the kneecap. So what happens here is sometimes you also have chondromalacia, and that's the back of the kneecap. Those things also start breaking down because they're rubbing against this part of the femur and the tibia. So these are the things you want to look out for, and we want to stabilize as we go into our treatment plans and thought process. Well, I hope you enjoyed that anatomical explanation of how the knee and the hip and the ankle are related and how that affects you. So just some general recommendations. Definitely check with your healthcare professional. Make sure this is the right recommendations for you, and obviously listen and do things at your own risk. If it's tendonitis, it's usually an acute stage thing, and usually within 72 hours you have some inflammation. You want to ice, you want to compress, you want to rest. That's the recommendation. And also the same thing with tendinosis, more of the chronic things. You do have to get rest, but the problem is, you want to get things restored, and I really do want to re-emphasize the stability at the hip and the mobility and stability at the ankle. I think those are the main places to take a look before you start treating the knees or foam rolling or whatever. So those are things that really come down to awareness, and we have great awareness exercises. We'll plug them in below, but really trying to get those things stable, make them more automatic with every step, every motion, every push off, even if you're jumping. Those are really important to get that hamstring muscle kicked in. So that's really what I would like to recommend and let you guys know a little bit more about. But make sure this is the right recommendation. Of course, check with your healthcare professional. So I'm Dr. Lin from Rehab and Revive Physical Therapy. Remember, we can and we will get better together.